Good evening, fellow healthcare professionals. I want to welcome you all to tonight's continuing education seminar. I'm going to start off with a personal experience that I had several months ago. I was working in the emergency department, and see if you can guess what our topic of discussion is tonight. Imagine sitting behind the nurse's station around 3 a.m. catching up on a patient's chart when a very panic-struck mother runs through the triage door holding her limp, listless child in her arms. You swoop her away, and as soon as you feel her little body touch yours, you know what brought her here. You can feel the heat penetrating through your scrubs. As you rush her into the room and gently place her on the stretcher, you ask the mother, "Have you checked her temperature?" The mother replies, "I felt her before I put her to bed. It didn't seem that high, and I thought she would be all right until this morning. Is she okay?" You look down at the child's flushed face and notice her eyes begin to roll back in her head. Her body becomes rigid. You call the doctor. "Come on, doc. We got a kid having a febrile seizure." In order to prevent this, we must be able to educate parents on how to identify, monitor, self-treat, and when to seek further medical care when their child has a fever. We will first discuss what is considered a fever and what instruments are used to identify one. Next, understand how often we monitor a fever and what medications are used. And finally, discuss when it's time to seek further medical treatment. Remember that fevers themselves are helping the body get rid of infection or illness. So fevers are not dangerous for most children and infants over the age of 3 months old, okay? The easiest way to see if a child has a fever is to take their temperature, all right? There's multiple ways to do this. All right, according to the American Academy of Pediatrics, your child may have a fever if his or her temperature reads above these amounts, all right? Rectal, 100.4, oral, 99.4, axillary, 98.6 degrees, and tympanic, 100. Let's remember these so we can educate our parents, all right? Not all kids are going to let you do a rectal temp, so let's teach moms how to do axillary temperatures and oral temperatures as well. There are a few children who will have a seizure when they have a high fever, but this is very infrequent. So when we recommend treatment of fever, we actually are not treating a fever because itself is dangerous, all right? Remember this, all right? We make the recommendation to treat a fever so that the child is more comfortable, will eat and drink better, and sleep better, because we all love our babies to sleep, okay? You have to give the proper doses of the antipyretics for this to be effective. All right? According to the Journal of the American Academy of Pediatrics, the most common medications to use to treat fever in children are acetaminophen and ibuprofen. All right? Physicians do not recommend the use of aspirin because they have serious side effects, such as Reye's syndrome. All right? Doses of fever-reducing meds are given by weight and age. Remember that both acetaminophen and ibuprofen come in drops to be used in infants, elixirs to be used in toddlers, and chewable tablets to be given to small kids and older kids. They love those chew tabs, okay? Drops and elixirs are both liquids but contain different amount of the meds. You must verify the dosages. All right, take the time to teach parents how to read labels. You will find that parents are willing and wanting to learn, okay? Here are some of the tips that I use as a nurse when dispensing meds. Read the label not once, not twice, but 3 times, okay? I know this sounds like a lot, but you don't want to overdose your children. Read it before you open the bottle. Check it again after you measure the dose, and once more before you give the medicine. Do not give the medication more frequently than the label or your provider recommends. Remember to check and see what other medications the child is on, because many of the cold, allergy, and flu medicines also contain the Tylenol and the Motrin in them. You don't want to double dose your kids, okay? Be sure not to give the children too much. We now come to the topic of when to give the medications. If the child is running high fevers that are difficult to break, the Tylenol and Motrin can be alternated every 4 to 6 hours. Remember, the key word is alternated. You don't want to give the meds too close together because of possible overdoses. So by alternating the meds, you don't give the same medication closer than every 8 to 12 hours. And that's the key to this, okay? The best time to check the children's temperature is going to be when it's time for another dose of med. Please remind parents that fevers don't go away when the children sleep. Sometimes they actually increase in the night, and you must wake them up to recheck their temp, okay? If the antipyretics are just not enough, if they're just not working, here are some other ways recommended by the American Board of Pediatrics on how to treat a fever and keep your child comfortable, okay? If your child is shivering, keep them warm until the shivering stops. If your child is not shivering, strip them down. Get them out of those footy pajamas. Get those fleece covers off of them. They don't like it, but do it. I always strip mine down to their underwear and a sheet. Okay? Encourage the child to drink fluids to replace the ones they're burning off caused by the fever. They're going to burn off a lot of this. Pedialyte, Pediapops, you've got your electrolytes, that type of stuff. You can sponge the child down with lukewarm water. You can put them in a tepid bath. All right, put them in a tub, 1 to 2 inches of water, sponge them off on their arms, legs, and trunk area. If the child begins to shiver, take them out of the bathtub. Finally, do not ever, ever, ever use rubbing alcohol to cool a child. It can be absorbed through the skin and inhaled by the child. This is extremely dangerous. All right, here are some key points to tell the child's caregiver in regards to the fever. Always call your medical provider if the child is younger than 3 months old, if the child is vomiting or complaining of abdominal pain, or if it goes longer than 24 hours without a diagnosis, okay? Fevers can be scary for caregivers and healthcare professionals, so imagine how they're scary for parents. Knowledge is power, so take the time to educate the parents and ease their worries. Besides, there's nothing worse for a nurse than someone placing a limp child in their arms, so take care, y'all, and take care of your patients. Have a good night.